Today, I'm going to talk to you about wrist pain during pregnancy and in the early postpartum period. So there are two main types of wrist pain that we see in the clinic. The first one is carpal tunnel, which is a nerve-related pain that happens on the front of the wrist. So symptoms can be pain or numbness or tingling in the middle fingers or in the palm of the hand, and pain with gripping or loss of strength with gripping. So you might notice it sort of you're dropping things more regularly or finding it hard to hold on to things, your coffee cup, dinner plate, and maybe some occupational things for those of you that are still working. The carpal tunnel itself can be a little bit tricky to manage, and we definitely want to intervene as early as possible because it is something that if it isn't managed well early on, by the time we progress through the pregnancy, extra fluid can impact, and is usually one of the reasons why the nerve itself is irritated as it passes through the carpal tunnel. Swelling in around that area can cause compression, so as you go through the pregnancy, more fluid is likely to accumulate. And then post-pregnancy, in that early postpartum period, sometimes it does disappear on its own. Other times it can be irritated, particularly with all of the baby handling, so lifting, holding, nursing. The other type of wrist pain that's quite common is Quervains, a fancy name for thumb-sided wrist pain. So usually symptoms will be on the inside of the wrist, so complaining about pain on that thumb side, maybe even up into the forearm as well. Usually is quite tender, maybe a bit swollen, and it's the tendon sheath of the thumb that sort of keeps the tendon down that can become irritated again, usually from swelling or some inflammation, potentially even some occupational risks, so maybe lots of typing or writing. Again, it's something that we want to manage as soon as possible, because once you're nursing, lifting, holding, padding with a baby, particularly that sort of lifting movement can be really quite aggravating for the thumb, even pushing a pram. So we wanted to try and get onto both of those problems early in the piece as soon as you notice the symptoms, because early intervention is best. Sometimes a splint is required for both, so you can get some over-the-counter splints from the chemist, but I usually recommend having a custom splint made, and I usually refer my clients to Flex Physio in Murdoch. They are hand specialists and they also do fitting of the thermoplastic splints, so nice custom splints. There are some pain relieving techniques that we can do or try for both of these problems. However, it is very different person to person as to whether relief will be provided. We do give general advice about limiting stressing and straining those structures when sleeping, trying to sleep with the wrists straight as opposed to sort of curled up. We're getting all nice and cozy, particularly in winter. So trying to sleep with the wrists more straight, being mindful of picking up any other kids, children, toddlers, babies, trying to change and modify the activities that you do. And then sometimes some soft tissue work can help to relieve the pain, but it is best to see a physio as early as possible for the best outcome. If you have any questions, please leave them below. Otherwise, I think that's all.